Hello everyone. Today, I'd like to talk about a crucial medical procedure, urinary catheterization in males. This presentation will cover what it is, why it's done, how we prepare for it, the equipment involved, and the step-by-step procedure itself. First, let's define urinary catheterization. It involves inserting a sterile catheter through the urethra into the bladder to drain urine out of the body. So, why do we perform urinary catheterization? There are several key objectives. To drain urine in cases where a patient has urinary retention, cannot urinate on their own, or has a bladder muscle dysfunction. For surgical purposes, to help reduce pain post-surgery. For treatment, such as managing bleeding in the urinary system or acute obstruction. Now, let's look at the specific indications for indwelling catheterization. Patients who cannot urinate on their own due to lower urinary tract obstruction. To prevent urethral obstruction from blood clots. For critically ill patients, such as those in shock or after accidents or burns. Patients with more than 50 milliliters of residual urine after 2 attempts of intermittent catheterization. Patients with restricted hip movement, for example, those with pelvic bone fractures. Patients preparing for major surgery. Female patients with incontinence. Patients with bladder bleeding requiring irrigation. For comfort in terminal patients.
First, before we do anything else, we must verify the patient's identity. We need to check the patient's full name and date of birth and ensure it matches the doctor's orders. This is a critical step to prevent any errors. Next, patient preparation is extremely important. We must always introduce ourselves to the patient and their family, and clearly explain the purpose and necessity of the procedure. This transparency helps the patient feel more at ease and confident in our care.
Once the patient understands the procedure, we can begin the setup. We'll prepare all the necessary equipment and bring it to the patient's bedside. Next, ensure the patient's privacy by closing the door and curtains. We also need to make sure there's adequate lighting, and we'll cover the patient with a blanket. The practitioner should stand on their dominant side of the bed. We'll then help the patient into the correct position, which is the supine position with both legs spread apart. Now, we will proceed with cleaning the external genitalia using a flushing set. The proper cleaning technique is essential to prevent infection. Here is the flushing procedure. First, we need to wash our hands thoroughly. Then, we will open the flushing set. Next, pour the normal saline onto the cotton balls inside the set. Place a kidney basin next to the patient to collect any waste. Put on disposable gloves. Using the cotton balls, we will clean the area in a specific order. Cotton ball 1. Clean the pubic mound area. Cotton ball 2. With your non-dominant hand, gently lift the penis and retract the foreskin. Clean the urethral opening and then gently pull the foreskin back into place. Cotton ball 3. Clean the far side groin area. Cotton ball 4. Clean the near side groin area. Cotton ball 5. Clean the area under the penis, down to the scrotum. Once the cleaning is complete, we'll remove the gloves, dispose of all the equipment, and wash our hands one last time. I should also mention that if the patient is able to clean themselves, we can ask them to go to the bathroom and perform the cleaning on their own. Next, let's discuss the equipment needed. A sterile catheterization set, which includes a kidney-shaped basin for collecting urine, non-toothed forceps or sterile gloves, 3 by 3 inch gauze, 2 round bowls, 1 for 6 to 8 cotton balls and an empty one for used cotton balls, a fenestrated drape, the catheter itself, normal saline solution, NSS, for irrigation, lubricant such as KY jelly, 1 to 2 pairs of sterile gloves, a flushing set for external genital cleaning and a bedpan, a lamp or flashlight, a urine collection bottle if a urine sample is needed for testing. For indwelling catheterization, additional items are required. A urine bag, a sterile syringe, sterile distilled water, plaster. Next, we move to the sterile preparation. 8. Open the catheterization set using sterile technique. Add items to the set. If using an indwelling catheter, such as a Foley catheter, attach a sterile urine bag. Tear open the catheter packaging and place the catheter into the sterile set using sterile technique. Pour disinfectant solution or sterile normal saline onto the cotton balls until they are thoroughly wet. Discard the initial portion of lubricant from the tube, then squeeze the next portion onto gauze. 9. Place the sterile set between the patient's legs. For patients with altered consciousness, place the set on a bedside
10.
table. Arrange the instruments in the set in order of use, starting from the closest to the patient. 11. Separate one cotton ball and place it in the large kidney-shaped basin. 12. Use cotton balls soaked in sterile normal saline to clean in the following order. Cotton ball 1. Clean the pubic area from bottom to top. 13. With your non-dominant hand, hold the penis at a 90-degree angle to the body. If uncircumcised, retract the foreskin first. Cotton ball 2. Clean the urethral opening, wiping in a circular motion from the center outwards. Cotton balls 3 to 6. Clean the penis from top to base, all around. Do not wipe back and forth. (14) Remove the small kidney-shaped basin or used cotton ball bowl and the empty cotton ball bowl from the sterile set. 15. Remove gloves. Place them in the cotton ball bowl, wash hands, and put on a new pair of sterile gloves using sterile technique. (16) Unfold the fenestrated drape and place it over the external genitalia so the opening aligns with the catheter insertion area. Move the large kidney-shaped basin with one cotton ball and the catheter onto the fenestrated drape near the male genitalia. With your non-dominant hand, retract the foreskin. Hold the penis at a 90-degree angle. With your dominant hand, pick up one cotton ball and wipe the urethral opening. Here's how we proceed with the catheter insertion. 17. If a urine sample is needed for testing, collect a midstream sample by pinching the catheter to temporarily stop the flow. Have an assistant bring a collection container to collect about 30 milliliters of urine. 18. When urine flow slows or stops, gently press on the lower abdomen above the pubic bone with your non-dominant hand. With your dominant hand, slowly and gradually withdraw the catheter. 19. Once good urine flow is observed, insert the catheter an additional 1 inch. 20. Pick up the syringe filled with sterile distilled water and inject the water into the colored port of the catheter, according to the volume specified on the catheter tip, e.g., 10 milliliters. 21. Gently pull the catheter back until resistance is felt and it does not slide out, then push it back in slightly. 22. Connect the end of the catheter to the urine collection bag connector securely, ensuring no contamination. 23. Thread the urine collection bag, already connected to the catheter, through the fenestrated drape without disconnecting the line. 24. Secure the catheter with plaster to prevent tension or excessive slack. For males, secure it to the lower abdomen or inner thigh. 25. Remove gloves, wash hands, and raise the bed rails. 26. Hang the urine collection bag on the side of the bed, ensuring it is below the patient's body level and above the floor. 27. Clean and dry the genital area. Help the patient get dressed and position them comfortably. 28. Remove used equipment from the patient's bed, clean them, dispose of infectious waste, and wash hands. Finally, proper nursing documentation is crucial. Record the patient's fluid intake and output. Note the type of catheterization performed. Document the reason for catheterization, along with the date and time. Record the catheter size. Describe the characteristics and amount of urine. Note the patient's comfort level. Document any abnormal findings. Successful urinary catheterization requires correct preparation of equipment, adherence to sterile technique, and proper nursing procedures. Diligent care while the catheter is in place helps prevent complications for the